The heart is a remarkable machine that keeps the body running. It circulates blood 24 hours a day, 7 days a week, and pumps about 300 liters of blood every hour. I'm Dr. Freddy Gomez. Today, we'll talk about how the heart works and the silent heart killer everyone should know about. At a very young age, we're taught about the important role our heart plays. And after all, every organ in the body needs oxygen from the blood supplied by the heart to function every minute of every day. But there's more to this process than meets the eye. Here to talk about it are Dr. Enrique Posas. He is the section head of the Center for Structural Heart and Vascular Diseases at the St. Luke's Medical Center at Global City. And we also have Dr. Ferdinand Alzate. He is a training officer at the Cardiac Catheterization Laboratory at the Center for Structural Heart and Vascular Diseases, also at St. Luke's Medical Center, Global City. Welcome to the program, doctors.
Thank you.
So it's Hearts Month. So we're talking about the heart, how to take care of it, and this topic that we have both of you on is going to be very important as well. But before we talk about certain diseases, certain ailments of the heart, let's start off with the basics and talk about what the heart is and how does blood actually flow in and out of our body by the heart. Dr. Alzate.
Well, the body is being provided with a heart, which is a main pump,
Right.
which pumps blood, which is oxygen-rich and energy-rich to the different parts of the body. And the structure is basically hollow organ, very muscular, that is being provided by gates. We call them valves. We have 4 valves in our body. The right side, the tricuspid valve. On your left is the mitral valve, as well as the pulmonic valve. And the other one is the aortic valve.
With these valves in the heart, what happens when any or more than one of these valves are not working?
If you have a narrowing in one of those valves or a leak allowing blood going back in the direction which is not supposed to go,
Right.
then that creates significant issues with regards to function and with regards to blood supply to organs and other areas that you need it.
Could a person notice certain symptoms because of this?
Yeah, oftentimes what you normally see, what you would see is depending on the severity of the valve. So for example, if you have a valve in the right heart that is failing, tricuspid leaks,
Right.
then that feeds back high pressure flow back into the venous system. So you have large livers, swelling of the legs, shortness of breath.
Okay.
And as you go to the left, then you have the mitral valve leaking that creates pulmonary congestion or pulmonary edema that the doctors say. And if you have a aortic valve that is either leaking or severely narrowed, then that is complete impediment of the blood flow into the system, into the general system.
Okay.
All of which can decrease the ability to do work, to function, ability to breathe, ability to carry on with normal daily activities. And when severe, they can actually lead to sudden death and heart failure.
Okay. Now, collectively, these are called your valvular heart diseases, correct? So what is aortic valve stenosis again?
Aortic valve stenosis is the tightening of the aortic valve. The aortic valve is the one controlling the outflow of blood from the left ventricle to the left ventricular outflow tract going to the aorta. So the aorta conveys blood to all the circulatory system, including the brain, internal organs, and the extremities. So the problem with aortic valve is stenosis, that you have difficulty in the opening of the valves. So basically what is happening to your other arteries in the body, like coronary artery disease, is a process of what we call atherosclerosis, or the thickening of the lining of the structures because of other diseases underlying, like there could be some form of infections, trauma.
Now, Dr. Posas, who are mostly susceptible to these types of diseases?
In general, in the Western world, and as in our country as we age,
Right.
the aortic valve stenosis is usually considered as a degenerative disease, meaning there is calcification, fibrosis, matitigation valve, so in the valve will open.
Okay.
So what happens is Um, the symptomatology is related to how severe the valve is. The tighter the valve, the less the ability of the heart to keep up with the needs of the body. The equivalent analogy would be if you ask someone to run a marathon breathing through a straw.
Okay.
Because the
Right.
aortic valve area narrows down to 0.8, 0.5, anything less than 1 centimeter
Right.
is considered severe. So as the disease progresses and the aortic valve narrows, the symptoms become more acute until these patients develop heart failure. So they're unable to breathe, they're unable to lie flat in bed, they need a lot of pillows, they can't move around, they even can't go to the toilet because they get short of breath.
Okay.
In addition to that, once they develop symptoms, and this is important for the public to know, once patients with aortic valve stenosis have symptoms, they are at a greater risk of dying suddenly from sudden cardiac death. So it is very, very important to check yourself out.
Right.
So if they feel the symptoms that we talked about, chest pains, passing out, easy fatigue, shortness of breath and minimal exertion, or in moderate exertion, or developing an inability to lie flat in bed,
Right.
they should seek medical opinion and probably be treated more appropriately
Very well
or
said.
tested.
And because of that, due to the lack of awareness, valvular heart diseases are some of the hardest diseases to diagnose and treat. When we return, we'll find out the medical procedure that's changing the face of cardiac care and saving thousands of lives every day. More after a short break. You're watching Med Talk Health Talk. Welcome back to Med Talk Health Talk. Today, we're talking about valvular heart disease and aortic stenosis in particular. Still with us on the show is Dr. Enrique Posas, who is the section head of the Center for Structural Heart and Vascular Diseases at the St. Luke's Medical Center Global City, and also still joined by Dr. Ferdinand Alzate, who is a training officer at the Cardiac Catheterization Laboratory at the Center for Structural Heart and Vascular Diseases, also at the St. Luke's Medical Center at Global City. So until today, there was no way to prevent and no medications to treat aortic stenosis. But there's one procedure that promises to drastically change the game. So with this, Dr. Posas, could you tell us more about TAVR?
TAVR is a much less invasive treatment.
What does it stand for first, Doctor?
Or transcatheter. There are two terms that are being used
Okay.
all over the world. One is transcatheter aortic valve implantation, which is used by the Americans,
Okay.
and the transcatheter aortic valve replacement, which is being used by the Europeans.
Okay.
So both are interchangeable terms.
Okay.
But TAVR basically means that we can change the aortic valve with catheters without opening the chest and without putting patients on heart-lung machine.
Okay, as opposed to before, in order for you to treat that, you would have to open up the chest, very invasive procedure.
To open the chest, put them on a heart-lung machine, longer recovery times, and oftentimes they end up with smaller valves than we would be able to implant with catheters.
Now, Dr. Alzate, what makes this procedure better than any other type of procedure?
Well, as you can see, any one of us doesn't want to undergo under a knife.
Right.
That's for sure. So for us and the field of interventional cardiology, the device itself is very promising in a sense that you don't need to open up the patient. You just deploy it the way it should be, and the patient will recover in due time.
Is this TAVR ideal for those types of patient only, those who really don't want that more invasive procedure, or are there other benefits of TAVR?
Before the procedure itself, we need to screen all these patients. Doesn't mean that the patient doesn't want a surgery, then go to TAVR.
Right.
When the patient goes to our clinic, we usually screen them for appropriateness of management, either surgery or less invasive, which is TAVR. So we refer them to a heart team approach. So we have a heart team in St. Luke's Global City It is composed of two interventional cardiology, Dr. Posas, myself. We have a cardiac anesthetist, a surgical team.
Now, Dr. Posas, what is the success rate of a procedure like this?
The success rate is we're up to 97.9%.
Wow, that's
success
very
rate,
good.
for the procedure. We've done a total of 170 TAVRs at St. Luke's. There have been comparative studies looking at surgery versus TAVR. The data says that TAVR is equal to or better than surgical AVR when it comes to outcomes.
Okay.
It can be done faster. The procedure can be done even without general anesthesia.
Right.
Basically, like you would an angioplasty.
Okay, I think that's very important because to know the success rate. But I think what is more important that this type of procedure is available for Filipinos.
Yeah, we've created a Center of Excellence for Structural Heart and Vascular Diseases, designed for a more focused approach to treatment of these patients. In addition to that, it also creates an environment designed to treat these patients and to train the new generation of individuals who desire to train in these specialties.
Right.
The idea here is to promote the development of technologies and to introduce into our medical delivery services technologies that are less invasive and equally successful as the old tested surgical procedures.
Okay, very good. And but what Dr. Posas mentioned earlier is the importance of having those very skilled, very trained in this type of procedure. Can you expound a little bit more about that, Dr. Alzate?
Yes, as a training officer in this Center for Vascular Disease, actually we screen our applicants. These are cardiologists or interventional cardiologists who already graduated 1 year of intervention. And if they want to learn something about structural, especially TAVR, hybrid aneurysm repair,
Right.
endovascular, or the thoracic aortic repair, we teach them all the necessities, the in and outs of the procedure, and we'll make sure that they know everything. In our center, we cater not only valve procedures, but also aneurysm repair.
A lot of procedures with which concerns the heart is addressed by the center. But Dr. Posas, this is all well and good for people who are here in Metro Manila. It's easily accessible. But how about the Filipinos in other places, in other provinces? How would they be able to avail of such technologies as this?
This is precisely the reason why we decided to create a Center of Excellence. It's not only to have a center where people know where to go when they have the specific disease, but it is also to establish training programs that allows us to train the individuals from specific areas of the country and then return them back to the areas where they came from so that they can set up their own centers of excellence and continue to serve the local communities. Because it isn't about one individual doing this, it's a team of people.
Right.
And the beauty about it is that you have individuals with different specialties coming together to create specific plans for specific patients.
Do you have a final message for our audience, Dr. Alzate?
Well, to our audience, take care of our heart. Make sure to exercise regularly, eat a balanced diet, and make sure to see your doctor once in a while, every 4 months.
Dr. Posas?
Well, it is important that people in our country understand that these technologies can be done here, and that we have created environments that would allow us to achieve outcomes that you would expect from the best institutions in the world.
With that being said, we'd like to thank our guests for today, Dr. Enrique Posas, who is the section head of the Center for Structural Heart and Vascular Diseases at the St. Luke's Medical Center Global City, as well as Dr. Ferdinand Alzate, who is a training officer for the Cardiac Cath Lab at the Center for Structural Heart and Vascular Diseases, also at the St. Luke's Medical Center Global City. Thank you for sharing your insights on transaortic valve replacement and how technology creates options for people with cardiovascular diseases. And as we're learning more about valvular heart disease here on Med Talk, when we return, we find out how we can help prevent the early onset of cardiovascular diseases. All that and more only here on Med Talk Health Talk. I'm Dr. Freddy Gomez, and here on Med Talk Health Talk, we're giving the heart a break by finding out how to take care of it better. Exercise plays an important role in both the prevention and rehabilitation of many forms of cardiovascular diseases. And this is including the diseases we were talking about earlier. So joining us now is Ms. Erica San Juan, who is a fitness trainer with a degree in sports science, along with Mr. Michael Montes, who is the Director of Sports and Recreation, and they are both from Carry Sports Manila. Thank you for joining us today.
Thank you.
Now, we were talking earlier on the show about different diseases of the heart, and now we'd like to focus on how to prevent this. And one of the best ways to do this is having a good exercise plan and a diet plan as well. So let's start out first with Michael, and just how important is it that one has exercise or just a physical fitness plan in their lives?
Yeah, obviously, being that we work in a health club, we find it's very important. It's more important even to start at a very young age to prevent any diseases in the future. So for us, that's of the utmost importance that a few times a week that you find some time to work out, whether it's in a gym, in a class.
Now, Miss Erica, for people who have undergone certain procedures, such as certain heart procedures, maybe some surgeries, is it okay for them to still exercise?
I think, yeah, of course. Before we work out, for those people who undergone this kind of surgeries, we have to make sure that they are cleared by the doctor.
Right.
And then from there, we will make programs or any kind of physical activity that they can do slowly, and then gradually we can actually progress on that one. But of course, anyone can always work out. You're not too broken not to work out.
Right. Now, aside from being physically fit, how important is it, Michael, that the area in which, or the facility you work out in, should be at least complete with certain aspects?
Obviously, what you want to do is make sure that you find an exercise program that you're going to enjoy. Because if you don't enjoy
That's a good point.
what you work out on or what you do for exercise or your choices of it, then it becomes not motivating, you know. So that, along with getting results, is important as well.
Okay, that's a good point. Now, Erica, what are some of the exercises that one should avoid, especially people who have just undergone probably surgery or still need to heal slower at certain points?
Well, for me, before you work out or you choose any kind of workout, you should know your fitness level.
That's right.
That's why I recommend, if ever you're going to the gym for the first time, I would recommend for you to have a personal trainer or have an assessment first.
Now, Michael, apart from having a good physical exercise background or program, as you mentioned earlier, how important is it to match this with a healthy diet?
That's also very important. That's probably, if not more important, at certain points, because you know what you do outside of the gym will directly influence anything that you do in the gym. So having a good balanced diet, you know, leafy green veggies, a lot of whole grain, a lot of fruits and vegetables. So those are things that need to be implemented into your diet.
There are a lot of aspects about trying something new, so you should know your body as well. May it be diet or any physical activity.
Fitness trainers as well work part and parcel with the physicians of the certain clients or patients that you might work with.
Yes. So as what I said earlier, we're doing this PARQ or physical activity readiness questionnaire. We can't actually let the client work out without any of their doctors tell us to do so, or if they are cleared already.
Right.
So we have to go hand in hand with the doctors as well if our clients are already ready to go with the physical activity.
That's right. And before we go, Michael, do you have a message for our audience?
Well, I think, guys, if you want to start on a workout program, please start out slow, as we just discussed. Make sure that you seek medical attention if necessary, and then find a program that you'd like to do and stick to. Something that interests you, whether it's CrossFit, whether it's doing classes or playing sports. You know, these are things that we can also provide at Carry Sports, and you know, just find something that you like.
Very well said. Miss Erica?
You're never too young or too old to work out, so find the best fit for you. Always make time to at least walk or join any classes or any You can engage in any type of personal training if you want to. So find the best workout that you can actually enjoy and stick to. So that's it.
There you go. And with that, we'd like to thank our guests for today, Erica San Juan, fitness trainer, and Michael Montes, program director, both from Carey Sports Manila. I'm Dr. Freddy Gomez. Thank you for watching MedTalk Health Talk here on CNN Philippines.